Welcome to Sonu Zahran YouTube Academy Official. Today's topic is myopia.
Accommodative. What is pathological myopia? Degenerative or progressive myopia. Rapidly progressive error which starts in childhood at 5-10 years of age high. Myopia in early adult life with degenerative changes. Etiology. Heredity-linked growth of retina is the determinant in developmental myopia sclera, due to stretching, which in turn causes degenerative of retina. Progressive myopia is familial more common in Chinese, Japanese, Jews, Arabs, uncommon among Negroes, Nubians, and Arabs. Genetic factors leads to more growth of retina. It will cause stretching of sclera because of that increases in axial length and started to degeneration of choroid. It will leads to degeneration of retina and vitreous. Symptoms: defective vision, uncorrected loss of vision. Signs: prominent eyeballs, elongation of eyeball mainly affects posterior pole and surrounding area. Cornea large, anterior chamber. Deep pupil. Slightly large. React sluggish to light. Fun's examination. Large and pale temporal edge presents a characteristic myopic crescent. Encircling the disc may be present, where choroid and retina is distracted away from disc margin. Supertraction. Crescent may be present on nasal side, retina pulled over disc margin. Diffuse chorizo-retinal atrophy. Degenerative changes in retina and choroid. Common in progressive myopia. Characterized by white atrophic patches at macula with a little heaping of pigment around them. Posterior stipholoma.
Due to ectasia of sclera at posterior pole. Degeneration of vitreous, liquefaction, posterior vitreous detachment, PVD, waste reflex EC, vitreous opacities. In this image, we can see lattice degeneration, tail traction, lesion. Liquid cracks are spontaneous rupture of elastic lamina of Bruch's membrane that appears yellowish white and usually located in the posterior pole. See here, the passage of light through the eyeball is hindered by the presence of the vitreous floaters which is generated. In visual field test, we can see contraction, rim scotoma. ERG reveals abnormal electroretinogram due to chorioretinal atrophy. What are the complications? Retinal detachment or tear, complication cataract, nuclear sclerosis, vitreous hemorrhage.
Glasses or contact lenses can correct myopia in children and adults. For adults only, with rare exceptions for children, there are several types of refractive surgeries that can also correct myopia. Optical correction is concave lenses. Basic rule of minus power. Minimum acceptance, providing maximum vision. Contact lenses are used in case of high myopia as they avoid peripheral distortion and minification produced by strong spectacle lens. See this image? 1. Myopic eye. Light focused in front of the retina. Image 2. Single vision correction contact lens. Image 3. Corrected by multifocal contact lenses. Multifocal contact lens have 2 power zones. Blue is add power treatment zone focuses peripheral rays in front of the retina. White area is correction zones for distance vision. Myopia.
Let's see what are the treatments.
Take vitamins capsules, do regular eye test, and maintain healthy diet. Other options are laser correction, exercises, and use sunglasses. Glasses or contact lenses can correct myopia in children and adults. For adults only, with rare exceptions for children, there are several types of refractive surgeries that can also correct myopia. Optical correction is concave lenses. Basic rule of minus power. Minimum acceptance, providing maximum vision. Contact lenses are used in case of high myopia as they avoid peripheral distortion and minification produced by strong spectacle lens. See this image? 1. Myopic eye. Light focused in front of the retina. Image 2. Single vision correction contact lens. Image 3 corrected by multifocal contact lenses. Multifocal contact lens have 2 power zones. Blue is add power treatment zone focuses peripheral rays in front of the retina. White area is correction zones for distance vision. Myopia.
Let's see what are the treatments.
Take vitamins capsules, do regular eye test, and maintain healthy diet. Other options are laser correction, exercises, and use sunglasses. Glasses or contact lenses can correct myopia in children and adults. For adults only, with rare exceptions for children, there are several types of refractive surgeries that can also correct myopia. Optical correction is concave lenses. Basic rule of minus power. Minimum acceptance, providing maximum vision. Contact lenses are used in case of high myopia as they avoid peripheral distortion and minification produced by strong spectacle lens. See this image? 1. Myopic eye. Light focused in front of the retina. Image 2. Single vision correction contact lens. Image 3 corrected by multifocal contact lenses. Multifocal contact lens have 2 power zones. Blue is add power treatment zone focuses peripheral rays in front of the retina. White area is correction zones for distance vision. Myopia. About SMILE laser eye surgery. Small incision lenticule extraction, SMILE, is an outpatient laser eye surgery procedure that changes the shape of the cornea to correct refractive errors. It is FDA approved only for the treatment of myopia at this time. Currently, we do not offer this procedure at the Institute, but will in the future. In SMILE, topical anesthesia is applied to the surface of the eye. Next, a femtosecond laser cuts a small lens-shaped disc or lenticule of tissue within the cornea. The shape of this lenticule is calibrated to match the refractive error of the eye precisely. The surgeon then extracts the lenticule through a separate cut-down incision, also made by the laser, to produce a shape change in the cornea. Your surgeon can explain the limits of myopia that can be treated by SMILE. Treatments for astigmatism and hyperopia are not yet approved. Not every patient is a candidate for SMILE eye surgery. Patients with thin corneas, progressive ectasia, scars, irregular astigmatism, and a few other pathologies are ineligible. Your surgeon, or one of the optometrists in his or her practice, can determine if you are a suitable candidate during a free screening examination. What to expect with SMILE eye surgery. SMILE laser eye surgery typically takes about 20 minutes to perform per eye, and both eyes are usually treated during the same session. SMILE is associated with minimal to mild discomfort while it is being performed. When the topical anesthesia wears off, however, the level of discomfort increases. Most patients develop redness and tearing. There is often stinging and a gritty sensation that lasts 6 to 12 hours. Visual recovery is slower than with a laser-assisted in situ keratomileusis, LASIK procedure, typically taking 2 to 7 days. As with any procedure, there is a risk of complications with SMILE, including the possibility of an undercorrection or overcorrection. The risks should be discussed with your doctor before you undergo the procedure. Enhancements are usually performed by photorefractive keratectomy. SMILE, small incision lenticule extraction, is a laser eye surgery that treats astigmatism and nearsightedness. SMILE may mean that you don't need to wear glasses or contact lenses anymore. You do have to meet certain criteria to be eligible for the surgery. Contents overview procedure. Details risks, benefits recovery and outlook. When to call the doctor, additional details. When to call the doctor. Overview. What is SMILE eye surgery? In small incision lenticule extraction, SMILE. Eye surgery, your surgeon uses a laser to reshape your cornea and treat astigmatism and nearsightedness. SMILE is a minimally invasive surgery. Its name gives an idea of what happens. The laser creates a lenticule and a tiny incision, less than 4 millimeters long, into your eye to remove your lenticule. Lenticules are disc-shaped pieces carved into your cornea by the laser. The shape of the tissue is like an MMR. Removing the piece of tissue is what changes the shape of your cornea. What does SMILE eye surgery treat? Your eye care professional may suggest SMILE surgery if you have refractive errors and want to be able to see without using eyeglasses or contact lenses. They may recommend SMILE eye surgery over other types of corrective surgeries if you have a higher prescription or issues with dry eyes. People who are candidates for SMILE eye surgery are at least 22 years old, haven't had a significant change in their prescription in a year, have prescription ranges that fall between specific parameters, nearsightedness that falls between 1 and 10, and astigmatism up to 3 diopters, have healthy corneas, are able to understand the benefits, risks, and limitations of SMILE eye surgery. Who shouldn't have SMILE eye surgery? Your eye care provider may not recommend SMILE eye surgery if you are pregnant or breastfeeding, chest feeding, have frequent changes in prescription for glasses or contacts, have severe glaucoma, have scars on your cornea, have certain types of skin disorders, have keratoconus, have unmanaged diabetes, have a cataract that's affecting your vision, have had certain kinds of eye surgeries, injuries, procedure details. How should I prepare for SMILE eye surgery? In a pre-surgery appointment, your surgeon will examine your eyes to confirm you don't have any other eye diseases or conditions that mean you shouldn't have smile surgery. They'll map out plans to remove the lenticule from your eye. For example, they'll measure your cornea's curvature and thickness. Your provider will let you know how to prepare for surgery. They'll ask you about the medications and over-the-counter supplements you take. They'll let you know about medications you should stop taking before the surgery. They'll also tell you when you should stop taking them before the surgery. Your provider will advise you if you need to stop drinking or eating the day before the procedure. What happens during this procedure? Your surgeon will numb your eye. They'll use a femtosecond laser for the surgery. The laser will create a small disc of tissue from your eye that looks much like a soft contact lens. It will be thicker in the middle and thinner along the edges. This disc is the lenticule. Your surgeon will use the laser to make a small cut into your eye so they can remove the lenticule. By doing this, the surgeon changes the shape of your cornea. Thanks for watching. Don't forget to subscribe.